So now that we've had folks help us through the technical challenges, I'm Jana Davidson. I'm Chief Medical Officer for Children's and Women's Hospital, and I'm absolutely delighted to welcome all of you who are joining virtually and those that are in the room with us today to this town hall, the first of two regarding the Institute of Global Health. We are, and when I say we, I'm speaking of the senior leadership team here at Children's and Women's Hospital, myself, Sarah Bell, Chief Operating Officer for Children's, Cheryl Davies, Chief Operating Officer for Women's. Just absolutely excited about where things are moving with the Institute of Global Health, newly formed this year, to really represent global health across our campus of care, and under the phenomenal leadership of Mark Ansermino and Gina Ogilvie, I can feel the momentum building, and it's so timely in terms of what's happening globally, and we have an obligation in many ways, and one of those obligations as a tertiary academic learning health sciences center is to engage with and work with and learn from colleagues globally and contribute to the health and well-being of children, women, and people in a global context. And we're very committed to this work. So I'm delighted to be here and provide a few opening remarks. I do want to acknowledge that we have the privilege today of joining virtually on the traditional, ancestral, unceded, and occupied territories of the Musqueam, Squamish, and Tsleil-Waututh nations of the Coast Salish people. As I reflect on this privilege and what that means and what's happened, First Nations communities have been living in these lands for about 9,000 years. There's been villages found along the Fraser River, very close proximity to us, that are dated back 9,000 years. And so if we think about our presence on these lands, it's been for a minute, and we've had a significant impact. And so as we're living through our summer and some of the things that have happened as a result of our stewardship of these lands, I think it really humbles me to think about our obligations in terms of truth and reconciliation to our First Nations people, and how grateful I am for their wisdom and stewardship over the millennium. Next slide, please. So with that in mind, PHSA was recently gifted 6 teachings from Musqueam knowledge keeper Sulkson Shane Point, and these have so resonated with many, and certainly with me. And when I think about the relationship of our work towards truth and reconciliation of our Indigenous peoples, I like to think about how we take that outside the borders of Canada in the work that's being undertaken in global health. And these teachings really, I think, bring that front and center in terms of approaching the wisdom and culture of the first peoples in the lands and countries in which we're working globally outside Canada, with the idea of truth and bringing good medicine, thinking about us as a global population, opening our hearts and minds to their knowledge and wisdom and needs, and making up our minds to be strong and humble as we do that, and to do our best. And these are simple phrases, but they are profoundly deep. And as I've talked with Mark and Gina about the importance of the work that we do outside the borders of Canada in global health, it's really anchoring that work with these learnings that our First Nations people have entrusted to us, that we can be guided by. And so I will turn it over to them now, and Gina's going to say.
And I'm just going to stand. So if you just
Sure.
aim that this way, therefore, then I can see folks a bit too. So thank you. I want to thank the global health team who spent so much time planning for this. But of course, what usually happens is technology. We have a little glitch, so we're just getting it sorted here. So thanks to everyone. So it's really exciting to have people in the room. Really exciting to have people online, and Mark and I are just so thrilled about the support that we've had from people like Jana in moving this forward. I can't underscore how transformative that has been for us for global health on this campus. So, and we're just knowing Jana's schedule for her to be able to come and spend time with us. I think we all feel really honored. So thank you so much, Jana, for those opening words. So I'm going to do a brief background. I'm not sure, I'm increasingly asked to give the history lessons, and I'm trying not to take that personally in any way. I'm trying to embrace that. So, but I am here to do a bit of a history lesson, but then also just talk about what, really our approach that we have really endorsed, and it's really aligned with what global health means now. So, as many of you know, there was a Center for International Child Health established in 2004. That was an initiative in the Department of Pediatrics, so really anchored in pediatrics. But although it was anchored in pediatrics, we all worked across campus, and we all worked collaboratively across campus. I sat on the executive CICH, although my appointment is with women's, and many of us work collaboratively. But we received strong leadership from Women's and Children's Hospital. But there was really an effort in kind of the sort of 2010s to really actually be much more formal and recognize the need for us to come together across campus formally. And we were very privileged to have the leadership of the hospital endorse that. And we had a retreat just before COVID in 2019, where we really said that one of the key things we had to do was formally come together across campus. We did pause due to COVID, but we were able to restart in 2022. So that's sort of the history of where we've been. But I wanted to touch on, and next slide, please. I wanted to touch on a bit about the approaches that we're really committed to. And so many of you will have seen Stephen Hoffman at CIHR talking about this. And it's really about the evolution of global health and how we've really moved from global health 1.0 to 3.0. And that is our commitment to this approach of global health that is really grounded in a collective action with shared responsibility and understanding of shared risk. And Jana said something really important. She said, we are also here to learn. So rather than sort of the more colonial approaches that we have with Global Health 1.0 and thinking about some of the international health, Global Health 2.0, we're really about a partnership. So next slide, please, and we'll just run through these. And I would encourage any of you who are interested, Stephen Hoffman gave a keynote at the Women's Health Research Institute Symposium about 2 years ago on global health, and why CHR was sort of formally adopting it. And it's a great lecture that really encapsulates, and he speaks with great passion and knowledge. So Global Health 1.0 really emerged from the protection of colonial representatives from tropical diseases. That's where it came from. So you also may have heard tropical medicine. So that was about 100 years ago. And really it was a very much a different era, different paradigm. And I think that's really important for us to keep in mind the history when we start to talk about global health. We have to work to really overcome those very overtly colonial approaches as we undertake global health partnerships in research, policy, and practice. Next slide, please. There's an evolution to Global Health 2.0, as we called it. Many folks might call it international health. So that was where wealthy countries who had more capacity would go and help those who had less capacity and economic capacity, really. Very much a charity model. Very much intended with good intention, but we really see a transformation from this to Global Health 3.0. And this is where we are really committed to, which is not a charity model, where it's a model that you recognize that we are all in this together. and that we share many of the same challenges: climate change, AMR, gender equity. Those are across borders and across nations. And we have shared risks and we have shared responsibilities, and we need to really look at that. So it's about our interconnectedness, and it's about how susceptible we all are to challenges that we all face. So really want and just want to anchor back to what Jana said about learning from each other. Because knowledge is not a one-way street. And I can tell you, just for me, I'm so grateful for all the work I've done with cervical cancer in Uganda and Rwanda, as we now look at HPV testing here in British Columbia. And I rely on that knowledge and experience from my colleagues, Dr. Carol, from my colleagues, Dr. Stephen, to be able to offer some of the guidance here. So, and that's just one example. I know everyone in this room and probably online have similar experiences. The next slide, please. So this probably captures it. And if you remember one thing, and I think everyone around this room and online already has this, but we really are committed to equity at the center of everything we do. And some of the key approaches we want to think about is humility, authentic partnering, inclusion, shared benefits, a commitment to the future, and also, of course, responsiveness to the causes of inequities. But really, these principles are anchored at the core of achieving equity across the world. Next slide. So one of the things we said at the Women's Health Research Institute when we had this conference was that every health researcher is a global health researcher. And I think that's a helpful way to think about it. Even if you're working in a center in Canada, your work has global impact and your work has global relevance. And so these are just some of the ways we see that your health research can be really anchored as a global health research outcome. Next slide, please. So these are also one of the connections that we do is to really think about how we're connected to other populations. And so by thinking globally, we have a lens that allows for a wider view and potentially more comprehensive solutions that really actually tackle underlying determinants. So we certainly need these focused approaches. They can help us crisp up, really get to some basic science and basic approaches, give us some critical evidence. But we want to start to contextualize in the broader context. So that's what we've really been doing, and global health issues demand that we have a global and comprehensive lens, sort of anchored in some of our more narrow views and then broadening it out. And I think that's a really important commitment for us. So again, I don't think this is probably new for everyone, but I really want to sort of acknowledge that that is the approach and the commitment. And we feel really grateful to have the commitment of PHSA and the commitment of the hospital and centers to doing work in this way. So I think now I'm going to hand it to Mark to give us our next few updates on where we're going.
I'll just.
You're going to sit.
Yeah, so Gloria, Gina, I am able to talk while sitting right over.
It's not mine. Yeah.
And thank you to those that have put comments in the chat. If you have any questions for us, please feel free to put more comments in the chat. And I'm sorry for those of you online, we can't offer you food, but for those in the room, please continue to help yourself. There's lots of food there. So I'm going to just give you a little bit of an introduction into what we've been working on. And as Gina said, this is not work that I've done alone. This has been very much collaboratively with Gina and particularly Simona and Bella, but there's lots of other people that have contributed to this vision. So thank you, everyone. And thank you for all those people who've committed to participate in this. And the purpose of today really is to reach out to the whole community on campus and to make sure that everybody has the opportunity to be engaged within this new initiative. And I think that that's really the underlying essence and theme of that. So next slide. So you'll see what we did is we created this house. And this house took many hours of thought and consideration. And if you feel you've left out of the house, please let us know. We can still add you into the house. But the idea is that we're creating this house that everybody can work together and that we can have a shared vision and strategy centered on our commitment to equity and global health on the campus. And rather than us working in our silos, that we can all work together and leverage our strength, our inspiration, our incentives, all this innovation that we're having. And of course, this will extend our reach and impact that we can have globally. So that really is the the focus, the vision of the Institute for Global Health. As you will all be aware, there's lots of ongoing global health activities that have been supported through the Center for International Child Health previously, Women's Global Health, and individual investigations on campus. And we have in the past tried to curate, what the activities were. And this is just a map, and you can find this on our website, that looks at all the activities that are going on. And there's more than 60 different global health projects that are going on that various members of faculty and staff on campus that have are participating in these activities. And the goal is not to stifle any of these, but really to grow these activities and to integrate them more wholly within the strengths of the campus. To this end, we've created a governance structure for the Institute for Global Health. So in the middle of this diagram, you can see is the Institute for Global Health. And there's an executive committee, which we'll talk about now, which is really the decision-making body for the new institute. The institute reports directly to the executive team, and thank you very much to Jana and Cheryl and Sarah for fantastic support that they've given us over the last few months and actually being put this together. And I think that this is the position of where this governance sits really speaks to the commitment of the institutions to make this happen and to support us as we move forward with this important work. However, the major work and activities for the Institute are going to be within the working groups. And at the moment, we have 4 working groups: research, education, engagement and partnership, and nursing and allied health. There's a potential to expand these, but these working groups really work up through the executive committee to do the heavy lifting that needs to be done. Of course, we have the really important partnerships with the women's and children's foundations that have supported our activities for a long time and will hopefully continue to support us. But those are obviously really important key partnerships. And we are also in the process of building out an advisory board, which will assist us with the strategic direction that we want to take and really be global experts that are able to advise us in the progress that we need to make over the coming years. So just to give you some idea on who's on this executive committee, and there's obviously one doesn't want an executive committee that is too large. So we've had to make some difficult decisions of people that will and will not be on the executive committee. So obviously, Gina and I are the co-leads as medical directors for global health on campus. We then have representation from the executive committee, and you'll see that we have the chief medical officer, the chief operating officer for Children's Hospital, the chief operating officer for Women's Hospital, and then also the executive director for nursing and allied health and professional practice on campus. So very strong representation from key leadership across our campus. We also then have the research institutes representative from the Children's Research Institute and the Women's Health Research Institute. We are also in the process of recruiting colleagues from the low middle income countries onto this executive. And you can see that Nelson is the one recruit that we've had, and he will be joining our executive as of December. And we look forward to building this out further to make sure that the voice of those people that we are collaborating with in this true 3.0 version of global health, that their voices are represented on this committee. We then have representation from the various department heads. And once again, this is obviously not having every department on campus, but we have done a lot of work in trying to work out who are the large departments, how we can do this. And we do anticipate that these may rotate around, but we also welcome for any other suggestions if you feel that you aren't represented within this list on the executive. Okay, so the working groups. And as I said to you, that this is where the real work gets done, and hopefully where each one of you can feel represented in some way and hopefully participate and be engaged, okay? And the idea of this is to develop broad engagement, to look at developing strategic objectives, measurable objectives, and to ensure inclusivity across the campus and generate support. And obviously to develop networking and areas of focus within each one of these working groups. The commitment is something like 1 hour every 2 months, so it's not overly stringent, but obviously we need to make sure that when people are engaged in this, that this is appropriate within the particular hierarchy within the organization that you work, that this is, the permissions are required from the particular supervisors, but we are still in the process of recruiting. So if you are interested in joining one of these working groups, please contact me or Simona and let us know your interest, and we will try to fit you into one of the working groups. So, as I mentioned before, we have the 4 working groups: education, research, engagement and partnership, and nursing and allied health. We have the co-chairs, one from women's and one from children's in each one of these working groups. In addition to that, we have an executive sponsor. So we have somebody from the executive committee who is really the sponsor for each of these working groups to ensure that we get clear communication between the working groups and the executive committee to make sure that the needs of the working groups are clearly represented at the executive committee. So I'm very thankful to all the people who are volunteering their times to actually take on these roles. I'm very excited about this. We've had our first few meetings. There's an enormous amount of energy involved in these working groups. And we've had lots of discussion already about how to move these various initiatives forward. So either you can contact myself or Simona, or go directly to the working group chair in women's or children's and ask them if you can join, because at the end of the day, they have final say on what the makeup of these working groups are going to be. So in the meeting that we had in 2019, we spent a few days in Squamish, and we sat down and we looked at trying to prioritize what we should do in each of these working groups. And we came up with a whole list of things that we would want to do. And we would be very happy. And I mean, the idea of putting this list up is really to see if you fit in within these strategic goals, but also you have the opportunity to shape this. So these are by no means set in stone, but you can look at where the opportunities are. So obviously it's really important for us to prioritize areas of training across the spectrum. We need to increase capacity to provide quality of care in our partner priority areas. And I think we already do that to a large extent across the campus. We need to enhance educational opportunities for our trainees, but also for those trainees in low and middle income countries. We need to collaborate with our existing educational partners at UBC and SFU and other major educational institutions across the city. We need to establish a shared goal around education and what that would look like. We need to develop integrated educational programs with our partners, and there's a lot of that activity that's already going on across campus. And we need to support clinical capacity building and facilitate pre-departure training for our trainees. And that's already underway, and you'll hear a lot more of that over the next few months. As far as research is concerned, the idea that I think we've always envisaged is we would like to have every researcher across the campus have a global lens on what they actually do in research. And that's a little bit around that diagram that Gina showed, where you can work in your little silo, but the idea that every researcher should really want to have a global impact in what they actually do with research really resonates with everything we stand for within the Institute. So we need to work with our LIMC partners to identify priority areas, and we need to listen to them of what they actually need, to what we should focus our research on. We need to continue to support new and existing research projects and programs across campus, because as I mentioned before, there's lots of those already going on. We need to facilitate collaboration locally, nationally, internationally. We need to build trainee and clinician scientists research capacity both here and in our partner organizations. We need to increase the infrastructure that we have for both open and shared data. We've always recognized that data is going to be a key element of healthcare, both today and in the future, and particularly in low and middle income countries. We need to increase opportunities for funding. And we need to aim to have significant portion of funded projects with our low and middle income country partners as a principal investigator. So these are some of the goals that we said. The third working group we had was with engagement and partnerships. So we need to have a clear strategy for engaging with new partnership and to strengthen those existing partnerships that we have. We need to increase our visibility across our campus. So that's in other words, to do engagement across our campus like we're doing today. We need to strengthen the community and partner engagement, develop advocacy as a crucial function of the Institute. We need to conduct assessments to understand priorities and needs. We need to develop and sustain local, national, and international collaborations, and to identify and promote and facilitate new opportunities for global health equity across our campus. We do have a specific working group in nursing and allied health, and the purpose of this working group was really to specifically strengthen nursing and allied health, global health activities. This particular working group, we've identified there's a lot of overlap with the other working groups, as there is overlap between the working groups themselves. But I think in the fullness of time, we would like to see this nursing and allied health working group totally integrated into the other working group. So this is really a time-limited working group until such time as we can get them up to speed and fully integrated into the other working group. So this is really to build a community of practice, to support and lead global health activities, to develop a pathway for nursing and allied health involvement in global health education, research, and capacity building, to establish nursing and allied health-based projects and programs, to create global health training, mentorship, and research opportunities, and to increase opportunities and funding for nursing and allied health trainees from low and middle income countries. So those are the priorities of that particular working group. So now over to you guys. Do you have any specific questions that you want to ask us? And hopefully we can try and answer some of those questions.
And Mark, why I instilled was so that these folks.
Susan,
Yeah, that's why.
okay. You go to the front.
So maybe, is there any stuff online?
Yeah, there are some chats online, so can we just put those up?
No. Any questions that, I know it's a lot of information. Oh, Peter. Peter.
Hi, can you hear me now?
Yeah.
Yeah, thank you. I think this is a fabulous initiative. And I'm very naive to what's been going on, but I'm curious, is there an explicit or informal relationship with other folks that outside the children's and women's campus? For example, people at the adult hospitals or School of Population Public Health or other UBC or other university groups that are interested in global health. Just wondering whether you have any, it sounded like you might be building that, but I'm just curious to know what this state of affairs is. Thank you.
Yeah, Peter, thank you for that. And I think you're absolutely right. That's something we're aiming towards, and super thrilled that Marla's made it here today, who's been a dear colleague and has worked both at IGH and St. Paul's and several others. So I think that ultimately is where we want to go. I think you named our educational partners, who are also key to what we do. And I think this is part of what the working groups, and particularly the partnership group, is going to work on, is how do we formally make those links with our colleagues within the health sector in BC and also beyond. So yeah, absolutely. Interestingly, we were just talking about how the working groups overlap, and do the educational partnerships land with the education group a little bit more? Do they land a little bit more with the partnership group? I think that's all going to evolve, but absolutely those are sort of fundamental to what we want to do. And to have people have a place when they're interested in global health to come to here on this campus. So it's also the other, think about it the other way. Someone at Interior Hospital who's or Royal Jubilee is interested in global health. Where do they go? They can come to the Institute and know how to connect in. Thanks.
Yeah, maybe just to say, I think there's a long history of collaboration between many global health researchers on campus, at the School of Population Health, in Faculty of Medicine, and we hope to continue those.
Yeah, exactly.
It's certainly a big tent, big house.
So my question was similar to Peter's, and sorry if you covered it at the beginning, I missed the first few minutes. So you showed that great map with all the existing collaborations. And so strategically, is there a plan to try and specifically strengthen some of the existing collaborations that exist, or are you looking for new partnerships, or is it sort of a bit of both? And then related to that, some of these places that you mentioned, like Rare, so I think that's a good example where it's quite busy in terms of there's a lot of let's say institutes from the global north that have links to even I don't know if in different ways like relatively, so it gets a little bit almost competitive with some. So I guess strategically, what is is there a game plan in terms of where you're trying to build specific partnerships, or is it going to be depending on what is going to come organically from the people over here?
Yes, yeah. So that's a really good question, Amish, and thank you for that. I think there's a few key things about this. Is that I don't think that Gina or I, or even the executive, can really make that decision and say this is how it should actually go. I also don't envisage that we can ever say to a researcher that you cannot continue collaboration or create a new collaboration that is critical or for your research and everything. But I think there certainly is the opportunity for us to build much stronger partnerships, which would encourage that convergence of activities around specific locations. And Dave Goldfarb actually led an initiative before COVID as the lead of this engagement and partnership working group, where we sort of looked across the whole campus and just had a look at where all the global health activities were. And there's no doubt that there was a significant concentration in Uganda. So we had already identified that as a strategic location that we would do. And we came up with some ideas of how would we strengthen that particular collaboration within a specific country, and what would that look like? And we had an initiative underway to actually hire a person that we would fund in country that could help with some of the logistics, regardless of which location you're working at and things. So those were sort of the initial thoughts that we had of what that would look like, and we hope to continue to expand that as we move forward.
I guess first and foremost, want to acknowledge all of the work that the Institute for Global Health has done in this space, and seeing it evolve over the years that I have been a part of it is amazing to see. And in an area that has historically been challenged in establishing itself as a discipline, never mind with COVID and all of the challenge. So I just want to acknowledge how much progress you have made and applaud all of your efforts in that. And my question actually then is, how can we help you in this? And like, what is the best way from the group that has come together today that we can help support this vision? Do you want to start in the bubble?
Oh, okay. So Miranda, thank you very much, and thank you for the comments. Miranda, I think that it's like, obviously this is something we've got to do together, and we are only as strong as the support that we actually get from you and the rest of our community that we have. So, and obviously a crucial part for that is for you to bring the voices of the partners that we have in low middle income countries to us. And I think that that's the most important point for me personally, and I think probably for us as to actually be able to address, because it's all very well for us to have high aspirations of what we want to achieve and what we want to do, but if that's not aligned with what they need or what they desire, I don't believe that it's going to be successful. So I would say first and foremost, that's the key thing that we actually need to do.
Yeah, and I think part of why we set up the working group structure was so people had a place to go with their ideas and what is needed. So I think being engaged with that structure, and that's why we provided the names, and we've got our names here so we can direct people. So for instance, with the Nursing and Allied group, really vocalizing to them, to folks like Dave, hey, this is what I think we need to prioritize, because the working groups are really going to set the priorities for those topics. So, I'm looking at several of the folks here are researchers. That's going to be really important for the research group to understand, what do you see as priorities for us to be engaging in global health in an authentic way, where equity is at the center, and where the needs and priorities of our LMIC partners and Global South partners are essential. So I would really start with that. I also think this is an evolution. So this is what we're starting with now. We're sort of trying to pull this together. I wouldn't be surprised in 2 years if there's some more sort of formal ways, interest groups, speaker series, training modules, all of those kind of things. And we'll be coming to you and, asking for your engagement now. So I think it's definitely, we're here to listen, learn, get ideas, because we're building this.
There's two people online who have questions. We can start with Kate and then Nadia.
Hi, everyone. I don't know who all is in the room, so I'll introduce myself. I'm Kate Thompson, the head of psychology at Children's and Women's, and I'm excited to be co-leading and facilitating the allied health and nursing group. And I'm wondering, question for everyone there, anyone there, what are the ways that we might be able to communicate to our allied and nursing staff the real institutional support and backing here, and that this is an opportunity for everyone to get involved and doesn't need to be a side of the desk activity. And I'm just wondering if there are any steps that have already been taken or ways that we might be able to think creatively to encourage folks. I think that's the common messaging that I get back. I would love to do all these things, but I have clinical productivity needs that I need to meet.
So Kay, I think there's two parts to what you've asked. So one is how do we sensitize, let people know about what's going on? And I think that's the start of this, right? This is the start of this. And so I think we've got another one tomorrow. And I think we're probably going to look at, a regular series where we do that. We've talked a little bit about does the IGH sponsor rounds, once every quarter. So we're going to be starting to get out there. So I think that's the first part. And Miranda, I'm going to look at you a little bit. Just I don't know if you've got any thoughts, particularly because Kate asked, particularly around nursing and allied, about ways to even first sensitize people to this entity.
Yeah, well, I went through this conundrum myself just rather recently in engaging with point of care staff in the context of research. And the biggest lesson I think that I took away from that is like meeting them where they're at. So understanding like where people gather, what their workflows look like. Nursing is a bit easier in that regard because they gather in certain places. There's nursing stations, they're less busy in the afternoon. If you go on weekends or stat holidays, especially staffing is usually a little bit better. So meeting them where they're at has been extremely helpful in engagement. And for the allied health folks, it's learning at places where they do gather. So identifying like the leaders of those groups, like the professional practice leaders. And I actually have it all mapped out for both women's and children's, everyone. So I'm happy to share that with you. But people want to be met on like an individual or even like a group level. And that's what I found to be like the most effective marketing strategy, which has been a huge area of growth for me personally. Yeah.
That's great. So that's a great solution for the nursing allied to start talking.
Yeah, I mean, I would just totally agree with that. I think word of mouth is the most powerful tool that we actually have. And, that being said, and I think that we should embrace that in every way that we can. And, obviously, Kate, we're very happy to help your working group to try and with some resources to be able to do that. But it's going to grow, word of mouth is not something that you just do this in a day. But obviously, we also have ongoing activities within the Institute with a regular newsletter, with obviously an active Twitter account and various other things that we're very happy to, recruit people to sign up for the newsletter, to interact on social media, to actually be able to do those things. We also have a number of activities that happen during the year. And of course, the big one that's coming up will be our annual conference that we have on campus. And that will be happening probably early in February, and there'll be lots more announcements around that. So that's a good opportunity to get everybody together and to meet the other people that are involved in that. But we do plan to have regular rounds, academic meetings, but we're also very happy to take other suggestions on how we can actually engage. But I'll just come back to what Miranda said. I think a strategy around word of mouth communication is a very good one.
Yeah, I think it'll be important for us to circle back to that and keep brainstorming more, especially when it comes to nursing and allied health, because the getting the word out has not been the challenge. The challenge has been folks who don't directly report to me getting really concrete, clear support from their program managers. So maybe that's something that we can think more about offline is how we make that happen.
Okay, and then we have a question from Nadia. Will the IGH have any connection to the new Master of Global Health at UBC? For example, facilitating global health practicum-like opportunities for students?
You can also.
Yeah, so thanks, Nadia. So I think, you know, anchoring around trainees is fundamental to what we're committed. This is an academic health science entity. We're committed to trainees across all the professions. There's not just the UBC proposed MGH that's upcoming, but for instance, we have the WATCH program here, Women in Children's Health Masters, that is part of what we do. So we're very committed to actually being available to all of our educational programs and to be committed to making sure, and this is part of why we wanted this institute to come together. There's so much experience, expertise, opportunities here, and there's not really a great way for instance, SFU to come through and say, hey, we've got these students who are interested in global health. How do they connect with the folks here at Children's and Women's who are doing global health? So I think Nadia is probably a little bit bigger, that it's not just going to be the MGH at UBC, but really trainees across, you know, I think we'll probably end up starting a bit with the Lower Mainland, but why not if UNBC has a trainee who's interested in global health? Again, why couldn't they connect with us? And that's ultimately what we want to do. But we wanted to start by getting us together so that when people are doing global health work, they go, I'm going to make sure IGH knows, so that when trainees come, we can direct them. So, and Simona, I don't know, we're planning, one of the things we're planning to do actually will be sort of routine kind of regular surveys of our community to see what's going on. Are you interested in a student? Do you have research projects where you can take a practicum? What are you looking for? Just because that's going to be one of the first places. So yes to the MGH, but I think yes to sort of to all trainees as best we can.
Yeah, and maybe just a few things to add to that. I think we are already in the process of curating some of the opportunities that are available, because obviously it's not just the SPPH module in global health. The Department of Surgery has run a global health master's in surgical global health for a number of years. There's lots of other activities on campus. So we will be the connection center that will be able to connect everybody, because obviously the real opportunities, I think, is really to share resources rather than to try to, you know, burden people to create new resources. So I think that that's a huge opportunity and certainly a role that we can actually play.
Thanks, Nadia. Question? So did we get, I don't know if everyone here signed up, but make sure you've signed up for the IGH newsletter that we have. And, you know, we'll certainly be continuing with activities and we'll be surveying and getting a sense of what everyone's doing, because that's really, this is about a place for people to come together so that we can actually sort of build this community.
So thank you, Gina, and thank you very much for Jana for your kind introduction and for joining us today. And thank you for everybody who's joined in person. This is really an exciting opportunity. I think Gina and I are both so thrilled to actually be able to do this, and there's so much energy associated with it. So we ask you to join us with that enthusiasm, and please reach out to Simona, who's the key contact for all of these activities, and please let us how we can help you and how we can move this forward. And we really look forward to new ideas and new suggestions. And you know, this is a big tent. We can include whoever wants to be part of this tent. So we look forward to working with you over the next few years. Thank you.